Hi, I'm Dr. Tanvi Vaidya and I'm going to help you figure out how you can get started with your retinoid journey. The first question is why would you want to get started with retinoids? Now, what retinoids do is they prevent signs of aging on your skin. So, they prevent the onset of fine lines, of wrinkles, of dark spots, of open pores, all of that. They boost collagen production under the surface of your skin and they help you maintain that youthful look. What can you expect when you start to use retinoids? Nothing, to be honest. In fact, initially, when you do start, you could see a little bit of irritation on your skin, and it takes a while for you to get used to retinoids. But you will thank your younger self 10 years from now or 20 years from now when you will have much lesser signs of aging on your skin. Now, the next question is which retinoid to start with because there's so many options out there in the market. So, let me take you through the different potencies of retinoids available. Retinoids are a huge family of molecules, and we need to figure out what works for what. The lowest strength, or the tiny little babies of this retinoid family, are retinyl esters like retinyl palmitate, retinyl acetate, or even granactive retinoid. This is usually the best choice to start with for beginners in their anti aging journey. Followed by this comes retinol, then comes retinal, which is the aldehyde form, and lastly is retinoic acid or tretinoin. Now, tretinoin is one of the highest potency retinoids available. Tretinoin helps to prevent acne and pigmentation and diseases like ichthyosis. We use it when we need a much higher strength retinoid. Don't use tretinoin for anti-aging. Don't even use an adapalene for anti-aging. Okay? So essentially, now that you've chosen that you want to get started and you want to start with, say, retinyl esters or say a granactive retinoid, how do you know how to go about it? I'll tell you. First of all, start with just a pea-sized amount for your entire face and neck. What's left behind, use on the back of your hands because they need some anti-aging help too. Next, the frequency. The frequency should be just about twice a week. Don't use it more than twice a week initially or you're going to get a lot of purging, a lot of redness, a lot of irritation. Gradually, you can go up on the frequency, make it alternate days, and then make it daily. Once you've reached a daily strength of a retinyl ester, then you can move on to maybe a retinol. Again, start with a very low strength retinol, like a 0.3 or a 0.5%. Gradually, over the next few months, go up to a 1%. Now, you've started on retinoids, but you face some irritation. And what can you do to minimize this irritation? Let me tell you. For one, reduce the quantity of the retinoid that you use. Go down on the frequency. If you've faced a lot of irritation, a lot of dryness, scaling, redness, give it a couple of days till you repair your skin barrier. Your barrier needs to be good when you use retinoids. So give it a few days of just hydration and moisturization without retinoids till your barrier is restored and then get started on your retinoids again. The next technique that I'm going to tell you is a very popular technique that you can use on a regular basis to minimize irritation. This is called the sandwich technique. Now, in the sandwich technique, what we do is we sandwich a retinoid between two layers of moisturizers. So you can just use your regular moisturizer first, follow it up with a little bit of your retinoid, and then some more moisturizer on top to lock that moisture in and minimize all of that irritation. Another thing that I really like to do is I use a hyaluronic acid serum first on damp skin, then a little bit of retinol, and then I layer my thick occlusive moisturizer over it. Also, do remember that retinoids have to only be used at night because they get inactivated by sunlight. The next thing I'm going to address about retinoids is how can you layer retinoids. Now, when you're using retinoids, remember you always have to moisturize after it. So your moisturizer is always going to come in the end. If you're using serums like hyaluronic acid, use them before your retinoid. Even niacinamide can go in before your retinoid. Layer it with a retinoid and then apply your moisturizer on top. What should you not ever use with a retinoid at the same time is vitamin C, AHAs or BHAs. If you're using these ingredients, use them on different days or use, for example, vitamin C in the morning and your retinoid at night. If you're using AHAs or BHAs, try to keep them on 2 separate days. When can you start to see results with retinoids? Give it at least 12 to 24 weeks to start to show any improvement in your skin. However, I would suggest don't try to look for results with retinoids because retinoids are for anti-aging and you will only see results after 10 and 20 years when you're going to be looking much younger than your peers. Any more questions about retinoids, ask me in the comments.